Hi, I'm Freek Verheugt here at the European Heart Journal today at EHJ 2015 in London, and with me is Gerasimos Filippatos. He is Professor of Cardiology in Athens. Welcome, Jerry. And today you presented, I think, a very interesting study in heart failure, the EHJ trial. What kind of trial was that?
It was a trial in patients with worsening chronic heart failure and diabetes and/or chronic kidney disease. This is a very high-risk population, and we thought that this population with high morbidity and mortality, we should see if we can find better ways to treat this population in a phase 2B trial.
And what did you compare to what?
We compared an MRA, a mineralocorticoid receptor antagonist, which is 1A in the treatment of heart failure, both in the European and the US guidelines, with a new drug, the finerenone. And this drug has the specific characteristics that is more cardiac specific, and theoretically, an experimental level and in vitro could decrease the problems that we have with MRAs, hyperkalemia, worsening renal function, and this could lead to an increase in the use of these life-saving therapies.
Okay, and the control arm was the eplerenone, right?
Control arm was the eplerenone, and the active arm were 5 different doses of finerenone. This was a phase 2B, a dose-finding study. And the primary efficacy endpoint was an increase for more than 30% in a decrease of more than 30% in NT-proBNP.
Okay. And clinical endpoints you also evaluated?
There were clinical secondary endpoints. We used the composite endpoint of all-cause death, cardiovascular hospitalization, and worsening heart failure. And also we use a quality of life, Kansas questionnaire, and also the EQ5D, the European quality of life questionnaire.
And it was a double-blind trial, I assume?
Yes.
Okay. And what were the results?
In the primary endpoint, we've seen a similar percentage of decrease in all finerenone arms and in the eplerenone. And in the secondary endpoints, we've seen in all arms an increase an improvement, if you prefer, in the quality of life. And in the first exploratory endpoint, which is this composite clinical endpoint, we've seen, with the exception of the lowest dose of finerenone, better results with the finerenone.
Okay.
And the best of these doses that have been tested was the 10 milligram that has been up-titrated to 20 milligram.
Okay, good. And you think that will be the dose to put forward into a bigger trial, a phase 3 trial?
I think yes. Also, this was the safest because this was also a safety trial, and also we've seen the best results. You used, we evaluate several adverse events and serious adverse events. We've seen that the serious adverse events and adverse events leading to discontinuation were better in this dose. And also the decrease of GFR of more than 40% was better in this dose. And also, we've seen that the increase in sodium potassium was better in the 3 lower doses of finerenone.
So, if you're going to head for a phase 3 trial, will you then evaluate only 1 dose or 2 doses versus eplerenone? I assume.
I think that we probably will evaluate 1 dose. And it has been announced today that a phase 3 trial will take place, and I think that 1 dose will be tested. And as you know, in the World Congress of Nephrology a few months ago, the results of arch diabetic nephropathy trial have been presented, and in this trial, this was a phase 2 trial also, and Finerenone was successful, and I think that also in this indication a phase 3 trial will take place.
Can you give in a few words the differences between eplerenone and finerenone?
Okay, I'll tell you the difference that we know from in vitro models and from experimental models. It has been shown that at equimolar electrolyte levels is more improves cardiac function more finerenone than eplerenone, and also it has a better distribution between heart and kidney. It's 1-to-1, and in eplerenone is 1 in the heart and 3 in the kidney, and theoretically this could lead to more side effects.
Yes, that's clear. It sounds very promising. And is this drug also evaluated in other conditions like hypertension?
From as far as I know, I don't think. I think that the two ongoing programs are in diabetic nephropathy and in worsening chronic heart failure in high-risk patients with chronic kidney disease and diabetes.
Okay, so do you think that will be the venue for this new agent if it works in a phase 3 trial? Jerry, thank you very much. Congratulations with your study. I'm sure you will publish it shortly, I hope. And then we can read about the details of the study. Thank you for coming.
Thank you. Thank you for the invitation.
It was a pleasure.